A new profession for medical cannabis. There is an English proverb that says, "The greatest wealth is health." But still, it would be necessary to be able to maintain it. There are the ways of prevention, but there are also the ways during a deficient health. When a layman lacks knowledge on the subject of health, he will turn to health professionals. In our case, we are talking about medical cannabis, which is thus taken care by health professionals and more precisely by a multidisciplinary team. First of all, we have the doctors on the front line. He will decide the clinical examinations and the necessary tests such as blood tests, medical imaging examinations, etc. This in order to give the patient his diagnosis. From the diagnosis onwards, the doctor will suggest the appropriate therapies. Apart from the lifestyle, food, sport, sleep, physiotherapy may be possible, but also, in many cases, medications. When a medication gives too many side effects, or when the medication does not give relief from the pathology, a second option should be considered: medical cannabis. The doctor, having received additional training on this subject, for example, via the Medical Cannabis Clinician Society, their website ukmccs.org, can inform the patient about this option. The doctor will explain that there are several strains of medical cannabis for several conditions, the possible ways of consumption of medical cannabis, oral ingestion, inhalation, etc., the condition of having regular follow-ups with the attending physician, that in special cases, a referral to a psychiatrist or psychologist will be necessary, that in new cases, a recommendation from the doctor for a practiced orthopedagogue specialized in the cannabinoid therapy is necessary. Number 2, when a patient is eligible for a prescription for medical cannabis, but this patient suffers from psychological or psychiatric disorders, in comorbidity or not, he will be monitored by a psychiatrist or psychologist. Cases of insomnia, depression, anxiety, or people suffering from psychotic episodes are referred by the doctor for monitoring by these mental health professionals during treatment with medical cannabis. The psychiatrist or psychologist will make his diagnosis before the treatment with medical cannabis. Once the treatment for medical cannabis has started, the psychiatrist or psychologist will make follow-up diagnosis. That is, during the period of treatment of the patient with medical cannabis, he will be monitored and psychologically assessed at regular intervals. In the event that the patient stops treatment with medical cannabis, the psychiatrist or psychologist will continue the follow-up diagnosis for 6 months after stopping the treatment. Apart from the diagnosis, the psychiatrist or psychologist may, if he finds it appropriate, initiate cannabis-assisted psychotherapy following the methods of MAPS, M-A-P-S. Their website, maps.org. In a YouTube interview of Dr. Josh Axe with Dr. Bonnie Goldstein, titled Medicinal Benefits of Cannabis Compounds, podcast episode 44, the female doctor mentions self-medicating with cannabis. For some people, they find their way and it works, but for other people, they may need medical supervision. It is on this medical supervision that I would like to give you more information. Each patient who is eligible for treatment with medical cannabis will be recommended by the attending physician to undergo one or more consultations with a practiced orthopedagogue in order to receive more deeply medical supervision. Being specialized in the cannabinoid therapy, he will accompany the patient as needed. The practice orthopedagogue has pursued studies which will serve him both in his theoretical task but also in his practical task. Studies in orthopedagogy, a state degree either at a bachelor's level or at a master's level, will be useful in the pedagogic aspect, but also in the orthopedagogic aspects. Pedagogic when it comes to teaching and informing with diplomacy and adapted at the patient level on the subject of medical cannabis. Orthopedagogic when it comes to practicing the cannabinoid therapy with patients who enter more in the orthopedagogical care due to a less developed mental or physical capacity. These are the elderly, people with disabilities, mental or physical, and children. In order to assist these patients in the inhalation of therapeutic cannabis, the bachelor's or master's degree in orthopedagogy gives access to these professionals to communicate in such a way as to always keep in view the psychological and social needs of the patient. The practiced orthopedagogue is a professional not only in mental health, but also in physical health. In hospitals or homes for the elderly, they are responsible for checking parameters such as blood pressure or body temperature. This personalized and tailor-made care is especially important during the therapeutic relaxation, which is part of the cannabinoid therapy. During the therapeutic relaxation, the practiced orthopedagogue will check the patient's parameters, but also will use his knowledge of creativity in order to offer relaxation adapted to each patient. Indeed, in orthopedagogy studies, students receive an average of 6 ECT credits credits, sorry. This is over 150 hours of creative coaching. Knowledge of music is essential. The practiced orthopedagogue must have in his repertoire by heart hundreds of songs from all times, even songs from the 1950s. When the practiced orthopedagogue works in a hospital or a home for elderly people, he will also perform household chores. In the case of the cannabinoid therapy, the practiced orthopedagogue will often have the task of cleaning, especially when it comes to cleaning and disinfecting the basin of the patient who used to vomit. Because, yes, the less glamorous side of the cannabinoid therapy is the patient's, sometimes, not always, vomiting. A certificate in herbalism naturopathy is also necessary for the practiced orthopedagogue because he will have to educate the patient to eat correctly in a healthy way and diversified before, during, and after the cannabinoid therapy. The practice orthopedagogue will also have a certificate as a dispensary technician in order to have the necessary education to answer all the questions on the subject of medical cannabis, strains of medical cannabis, side effects, administration methods, etc. Certainly, the practiced orthopedagogue is a profession that requires a lot of knowledge and know-how, which he acquires with his studies and specializations, but this profession is especially and above all a profession of conviction and passion. This is why there is still one more condition in order to exercise this profession. So, apart from the study conditions, such as the bachelor or master in orthopedagogy, the certificate in herbalism naturopathy, and the certificate of technician in dispensary, there is the condition of expert in experience. The condition of an expert in experience is rare to find in a profession. Indeed, normally we ask for an internship during your studies, but an internship is not an expert in experience. In the event that the practiced orthopedagogue practices the cannabinoid therapy, there is a necessary added value of a completely different aspect, which is, as the name suggests, to be an expert in experience. This added value may seem inadequate or even shocking, but it is the basis of this new profession. This means that the practice orthopedagogue who is specialized in the cannabinoid therapy has, in the near past or even in the present, consumed medical cannabis for his pathology or pathologies. It is impossible to be able to practice the cannabinoid therapy without having consumed medical cannabis for oneself. All the teaching and support during the cannabinoid therapy with the patient cannot be done in an optimum way if the professional does not know what he offers to his patient. When the patient asks, "What is being high?" will he tell him what it is written in the books, or how he felt, or both? To conclude this topic, I would like to add a note on one aspect of the deontology in the cannabinoid therapy. The practiced orthopedagogue will not answer the patient's question if he is high during his practicing with the cannabinoid therapy, because, first of all, this concerns only the professional, and second of all, it may influence the view and the feeling of the patient towards the professional.